Digital media presentation is developed based on the National Chronic Disease Strategy, which was developed and produced in 2005. It has been designed to target chronic illnesses including 12 priority areas. These are asthma, cancer, diabetes, heart, stroke and vascular disease, as well as osteoarthritis, rheumatoid, osteoporosis, in addition to depression. NCDS is in place to change and eliminate the burden of chronic conditions within Australia. This document is relevant to patient care and, as explained in the strategy, is focused on the condition of intrinsic factors, influence on patients' daily life activities, for example, social circle and communication methods. It also focuses on environmental factors and is patient-focused surrounding these. This document will help health professionals to guide the future practice of outcomes of patients living with chronic conditions. This will minimise the financial burden on the healthcare system in the years to come. The overall aim was to create a benefit for patients living with one or more of these conditions outlined in NCDS and the supporting document, Australian Institute of Health and Welfare. This digital story has been designed based on Annette, a family friend. She's a 24-year-old female who has been diagnosed with depression. Australian Institute of Health and Welfare support mental illness as being a chronic condition in their priority areas. They explain the most prevalent mental illness is depression followed by anxiety. Annette had lost sight of her hobbies and recreational activities because of the development of depression, which was influenced by a traumatic event in her life, the near drowning of the daughter in her care. Annette decided one day she was sick of feeling hopeless and to blame. She decided to seek help, and because of this brave move was supported by multiple family members, friends and professionals in the community. Annette was able to get the help she needed. She is being treated with the antidepressant medication citalopram, and since this, her love for sport has returned, as well as her social ambitions, which is said to aid in depression, by Stanton et al. This treatment inspired her to do something about her love for sport, so with this she created a career in physiotherapy, which was an inspiration of hers before her diagnosis. According to the NCDS, action areas include prevention across the continuum, early detection, early treatment, integration and continuity of prevention of care and self-management. Early detection and early treatment of chronic conditions has been chosen for this creative work as it was used throughout the treatment of Annette. Because of that, she was able to recover quickly. Early detection and treatment is an action area which, when utilised, can be extremely effective in terms of recovery. It enables the patient to have access to services in the community and gives them information on how to help their recovery. It helps the patient to ask for help when it is needed, therefore reducing mortality rates. Whilst Annette will never completely recover from her illness, she will have a better quality of life because of early treatment and patient-centred care. Recognized previously, Annette's choice to action her life and emotions and develop a therapeutic relationship with her supporting group, she was able to recover from an emotional and psychological damage caused and was able to comprehend that the incident with her daughter was not her fault. Bowmans et al. A recommendation for Annette in the future would be to not blame herself when unfortunate events occur, to speak to someone if she feels that the damage from the event is upsetting her and causing emotional harm. This will mean that Annette has the support from the beginning. She will not have to deal with the events alone, and it will improve the overall quality of life, knowing she's never alone. As health professionals, we need to promote early detection and early treatment.